Hey everyone, it's Andrew. Welcome back to my channel. Today we're going to be discussing how to tie a one-handed surgical knot in the operating room. Earlier today I was with a couple medical students who had never tied this knot before, and between cases they looked up YouTube videos and were trying to figure this out. And so because they were having some difficulty, I promised to make a video for them to help them out. And so what we'll do in this video is walk through how to tie the one-handed knot step by step, and then I'll give some general tips and advice on how I learned it when I first started, and hopefully that'll help you if you're in the process of learning this. Okay, so for the purposes of this video, I'm going to be using unwaxed dental floss as my suture or rope that I'm going to be tying with. I generally recommend floss over other things like traditional sutures or silk sutures, just because it's readily accessible. You can get it at Target, Walmart, CVS, and it's cheap, and it's much easier than having you try to figure out where you can get suture material in the hospital, as well as you don't really need to deal with any needles in this process. So just get unwaxed dental floss, and then you'll need something. It could be anything to loop this around. So for the example of this video, I am using a clipboard and we're going to loop it around here, but in the hospital you can like loop it around the hand or the finger holes of a needle driver when it's clamped to something. You can do it on your scrub pants, you can do it anything around. So if you're like sending it around, you can use scissors and just loop it around that, as long as you kind of have some like pressure on this so you get some tension, but anything will work and it's readily available. What I recommend doing is basically grabbing a long piece of floss like this, long enough to similar to what you would use in the operating room. You'll loop it around wherever you're using. Clipboard works really well for this as long as it's not sliding. And then for a one-handed tie or surgical knot, you're going to keep one hand taut and the other one loose. So in this video, what I'm doing is I'm only tying with my left hand, and I'm going to keep tension on my right hand at all times, because I typically throw with my right hand with the needle driver, and so I'm either holding the needle driver in my hand with that, or it's just like instinctually the hand that I grab with. So I always tie with my left hand in most instances unless necessary. And so there's going to be two separate knots in this. What you'll do is first you'll keep tension on the right hand. The first knot is going to encompass, what you're going to do is take your index finger, your pointer finger on the left hand, you're going to cross it over the other one, okay, like this, the other stitch, and then you're going to bend your finger backwards. Okay, you're going to bend your finger and then you're going to hook it on the left-handed knot, rope that you're holding like this, and then you're going to push it away from you, and that'll pull this through. And then you can either push down with your index finger like this, okay, or you can pull it down like that, depending on the circumstance. Pushing down with your index finger like this is really useful for small spaces, like if you're suturing dura or something like that, or if it's a craniotomy, depending on the circumstance, or if it's like small down in the spine. Otherwise, for like skin, it's very easy to just kind of do this tension like this. But walking through this again, what you'll do is take your index finger, hook it like this, you're going to come across the other one, and what I find is bring your right-handed one towards this to facilitate this, and you're going to just bring it this way, you're going to cross over, hook with your index finger, and then make sure you catch this rope here, and then push it away from you, and then push down, okay? And when you're first learning this, the best advice I have is do this like repeatedly until you have it down. So walk through this and just repeat this until you have it cold, where you don't even need to think about it, you don't even need to see it. I can close my eyes and do this. When I was first learning this, I just basically watched TV and just repeated this until I had it figured out. So that's essentially what it is for that. That's the first knot, okay? Okay, so the second throw is going to be a little bit different. What you're going to do is you're going to take the left-handed rope, you're going to take your middle finger and cross it over right on top of that. Then you're going to take this pull hand and you're going to take this suture, cross it over your middle finger, then you're going to bend your middle finger, and then similarly hook the suture or rope, and then bring it through the loop there like that. And once you have it crossed, you again bring tension all the way down. So we'll walk through this again. You're going to take your middle finger, you're going to cross over with the other rope, you're going to hook back and then push this towards you and then tighten it up. So again, middle finger, hook, and then through. Again, middle finger, hook, and through. Okay, so you're going to repeat this until you have it down cold, and you don't need to think about it. Okay, and once you have it down, you have the 2 knots that you're going to tie for a one-handed knot. Okay, and so just figure that out. All right, and that's that. All right, and now when you're actually tying it in the operating room, you're gonna actually alternate these. So the majority of the time, what you're gonna do is first, when you throw the suture through with the needle driver, you're going to first tie twice with one of these knots. I prefer using my index finger first, so every single time I always use the index finger. So you're gonna throw 2 knots like this with the index finger the same exact way. The reason why you do this is it's going to essentially, it's going to be a slip knot where you can pull tension on the right-handed side, and that'll provide tension down where it slides all the way down to the tissue, and you don't air knot in the process. And then following those first 2 throws, you're going to do the opposite knot. So then you're going to go to your middle finger, okay, sorry, and then you're going to tie that. And then if you need to throw additional knots, you're going to alternate every one after that. And so it's going to be 2 knots, the same direction. So say my index finger, I'm going to do it that way, okay? And then after that, I'm going to do the opposite way with the middle finger, okay? And then if I need to throw more than 1 or more than 3 knots, I'm going to do the opposite every single time. So middle finger, pointer finger, okay? So that's really all you need to know as far as a one-handed knot. General tips I have, just get it down where you have each of these figured out, okay, until you have it repetitive. It's very easy to do this in front of the TV, watch a movie, and just spend a night doing it. Do the middle finger and the index finger, and then have it down, okay? And then once you have it down, then go back to alternating. So then you'll go to do your index finger one twice, like that, to get a slip knot, okay? And then you're gonna secure it with the middle finger throw as well, okay? So that's what you wanna do as far as learning this. General other tips I have is, once you have this down, sometimes what you'll find is you're used to using your, just your hands with like suture or whatever it might be when you're practicing, but in the operating room you're going to use surgical gloves. So once you have this down and you figure it out, grab a pair of like surgical gloves or exam gloves and practice this with gloves. I find that the exam gloves are a little bit too loose, so they're a little bit different than the tactile feel you'll get in the operating room, but you can grab a pair of sterile gloves and just use that, and you'll just practice with that. The other thing I have is when you first try this out in the operating room, the circumstances are going to be a little bit different, like than tying like this. The tension is going to be upwards, or it's going to be faced away from you, or you're going to be pulling depending on the length of the incision or where it's located. And so you'll have to adapt and adjust to that. That's something that you can't really practice at home unless you kind of rotate this and practice different kind of ways of doing it. But do expect that you might mess up initially in the operating room. Don't be worried about that. That's normal. A lot of times, like an attending or a resident or like will kind of force you on the fly, be like, try this, and then you'll screw it up. But don't worry about it. Just practice and get this down. But if you do this knot and you have it down cold where you can do it without thinking about it, you'll have a lot more success in the operating room when you get that chance, and that'll allow you to do more in the operating room as far as tying and having confidence with whoever you're working with. So if you have any questions, comments, anything like that, please post them below. I'll be happy to answer them. I know this is a little bit difficult and intimidating at times, but if you get it down, it'll be something easy to do, and I feel like this way of explaining it might be easier for you when you're learning. So thanks for watching, and please subscribe, and if this has helped you, please pass it along to your other students or whoever's learning this. Thanks a lot.